My friend Gigi is next door with Elmarie getting electrotherapy.
This machine is actually programmed for weight loss. So depending on your goals, I will be doing different programs on you. It's very safe. You cannot get hurt on this machine. It's not shock therapy. The nice thing about it is, you can go lie down that way. The nice thing about it is you will still firm up. Even if you eat the wrong food and you don't drink enough water, you're still going to firm up. So everybody's happy because they will see some results. We work on areas that are very difficult to get to with exercise. So we always try and stick to the inside and the outside of the legs. You know, if I would put it on this muscle, it will be much easier to handle the machine, but you can get to this by exercise. So we're trying to get to the really hard areas. Okay, now the first treatment that I'm going to do on you is actually working on your deep fat cells. So it's going to feel like needles pricking you, but what it does is it agitates the fat cell to open up and to get rid of all the toxins. You do have to drink a lot of water with this because you need to flush it out. So what you need to do is just tell me when it's enough. You should feel a little bit uncomfortable, but you shouldn't be in pain. You should really feel it grabbing your muscles.
Is it only working in the area where the electrode is placed, or
it actually works? It works at whole muscle area. It doesn't work only where the electrode is. It works at whole area. But what we do is we move the electrodes around because people sign up for a whole month, and I see them twice a week. Even people that do work out, I have a lot of people that do work out, but they have a really hard time getting rid of the sides, you know, the saddlebags and the hips and tummy areas.
Electrotherapy has been used for years to treat chronic pain and injured muscles.
So would you consider it more of a replacement for weight training?
Not a replacement, just adding on to it, and a good jump start for people that do want to start exercising. And that's all done now for the day. I'm just going to unhook the electrodes.
I actually feel pretty relaxed right now.
Oh, good.
Next. Look 10 years younger in just 10 days. Turning back her biological clock begins with a little tune-up at the spa.
Follow me, it's right this way.
Okay, great.
Nancy gets a series of groundbreaking new treatments to make her look younger from head to toe, including electrotherapy, vacudermy.
Feels great. Oh, so good.
And pressotherapy. Special compression boots are used to increase blood circulation.
That's perfect, Nancy.
Together, these procedures burn fat, tighten muscles, and increase the metabolism. I don't know, but I want to know what that fat-burning machine is. What is that? Bring that on.
Nancy is going to start shedding the years by relaxing at Spa 415.
Electrotherapy has been around for 30 years. It started with the Russian athletes when they were going to the Olympic Games. Now, the electrodes you can place on every muscle group that you want to work on. Now, Nancy wanted to work specifically on her stomach because she's had 2 babies and she wanted to just get that all firmed up. So it burns 700 calories. It's about it's like going to the gym for 7 hours.
Oh my goodness.
So it's a wonderful way to firm up. There you go. You feel that?
You're watching Southern California's CBS 2 News at 4:30.
Well, it's a way to lose weight without the sweat of a workout. And next at 4:30, special assignment shows you how some people are wired for weight loss.
In today's special assignment, how'd you like to get your body in great shape without having to move a muscle? Jennifer Sabe shows you how to get wired for weight loss. It might be hard to believe. 15, 14, 13, 12. But these 2 women,
Time to relax.
say they are doing the exact same thing.
Is that comfortable?
Toning their stomach,
You can really feel it.
firming their buttocks,
Wow, an inch off the bottom.
losing excess weight.
Okay, onto the scale for me.
But while one counts reps,
6, 5, come on, 4.
the other counts sheep. While one works up a sweat,
2.
the other takes a snooze. Yet the sleeping woman swears she'll be thinner when she wakes up.
The first thing I noticed when I got home and I looked in a full-length mirror, I noticed that there was definition in my stomach and in my thighs.
Definition, tight abs and toned thighs, and all Denise Grant says she does to get them is to attach electrodes to all the places on her body she wants to tone.
We place the electrodes on areas where need working, so be it the thighs, the buttocks, the inner thigh.
The electrodes are hooked up to a machine,
and a signal sent from the electrotherapy machine, which is computerized, to the muscle, which stimulates it to contract and relax as if you're working out, but you're not. You're lying down in a private room, music playing.
Candles lit, fountain gurgling, the smell of incense instead of sweat in the air. Just the kind of exercise atmosphere chiropractor Karen Algotz was looking for.
I had put a little weight on over the holidays, and I decided I wanted to get a jump start on working out and, toning up for the summer.
By February,
I lost 5.5 inches.
And that, says the electrotherapist, is about average.
On average, we have seen a 15 to 22 pound loss within 4 weeks.
Sound too good to be true? Harold Headland thought so too, but the 67-year-old was willing to try anything after heart surgery forced him to stop jogging, and he started putting on the pounds.
I got up to be 235, and I said, that's enough. So I saw this ad, and I said, well, that's worth a shot.
So twice a week, he moseyed past the gurgling fountain, walked skeptically into the softly lit treatment room, laid his head on the pillow, got himself wired up, and hoped for the best. And
in about a month, I dropped approximately 20 pounds.
You feel anything?
Electrotherapy isn't exactly new. Beverly Hills plastic surgeon Dr. Frank Ryan has seen patients use it for years to help rehabilitate injured muscles. Now Dr. Ryan is noticing more of his patients using it not to repair their bodies, but to build better ones.
I've seen in my practice a transition where electrotherapy is now being used by average patients that haven't had an injury or haven't had surgery, just to kind of maintain muscle tone and ostensibly to keep in good shape and perhaps to lose weight as well.
Dr. Ryan says you can lose weight. Of course, Denise, Harold, and Karen admit they also watched their diet. But not a one of them added traditional exercise, just used the electrodes to move their muscles.
It's actually somewhat of a physiologic process, so scientifically it does inherently make sense that it would work.
Down and in.
What it doesn't do, however, is work your heart. There's not much cardio benefit to laying down thumbing through fitness magazines. But if you're looking to short-circuit your bodybuilding routine, electrotherapy may be a way.
30 minutes of our electrotherapy session is equivalent to a 6-hour workout in the gym.
That's 6 hours of working out, Karen says, without working up a sweat.
I don't have to shower, I don't have to blow dry my hair, I don't have to redo my makeup. I just get exercise, rest, and I'm on my way.
Forget about that old adage, no pain, no gain. The motto here is gain, no strain.
Now, if you're wondering how it feels, actually, not bad. It may look rather barbaric, like electroshock treatments or something, but it feels more like deep tissue massage. And as always, Mike and Linda, you can find out more about electrotherapy by logging onto our website, channel2000.com.
And it used to be used for physical therapy?
Right, so the machine has been around for years, but they just recently started using it for weight loss.
Wow. Somebody comes in the middle of the night and cranks a machine up, you're not going to jump straight up.
Well, that's how you lose a lot of weight.
Thank you.
Thank you.